patients do ask me, so I have all three blocked. So if I do E-ECP, will I get a fourth one? No, it's not going to work that way. Just that your three is going to remain there. When you look at a heart,
the main trunk is there.
yeah, trunk is there, but there are thousands of branches, small branches. Like some are even as thin as it can only allow one red blood cell. That is how thin it can be. All right, there's millions of it. So these are going to actually grow even more. These are natural bypasses, which is happening during E-ECP. So that explains why patients with angina, after a course of it, they say, I don't have any more angina. Because we are looking at a blocked artery most of the time, looking at, it's blocked. We need to remove the block. We need to do something about the block. Now let's look at the heart as a globally, okay, we look at the heart. How to actually increase the blood flow to the heart. Okay, so that's when it comes like, exercise, things like that and all that. Even exercise promotes VEGF. So when a blood vessel or a collateral starts to grow, because it knows where to go, it knows where the demand is.
It has its own, what they call it, like its own senescence, its own like intelligence.
Right. Like my example I always give is, ambil pokok, any small pokok, tanam here, tapi kita tuang air dekat sini after about 1 meter away. After 3 months, you cabut the pokok, you see all the roots going there. So it's a very natural process. So that's how natural bypasses, which is collateral, starts to grow. You may have like a certain area is like really deprived of oxygen because of certain vessels are blocked. Now doing E-ECP, this natural bypass are going to start focusing at that area and straight going to start to go to that area and provide more oxygen. That relieves angina. Not like, it's very simple actually to see it that way, rather than trying to do something about the blockage so that to, And
how about like old infarcts or stars? What are you all seeing in terms of studies and journals? Okay. Is there any like miraculous kind of changes?
There's a lot. Heart sizes have those with slightly enlarged atrium. It has gone back to a normal size. It has. That's one. EF increases in
that one
every
for
patient.
sure.
Yeah. My lowest patient with lowest EF, it was 23%. It took him 5 minutes to actually walk into. And one round of E-ECP increased it to about 38. Second round, he was at 42, 45. But his life has changed. You see, quality of life sometimes is the most important thing. You can be alive, but you be sayo like that, you're going to be, you're going to be a burden to other people.
True.
But the man who needed a lot of assistance to actually get up, go to the toilet, now today he's walking by himself. You see? So quality of life improves. Not that alone. Sleep quality. Amazingly, a lot of my patients who have very bad sleep, especially they have low GFR, CKD, second stage and all that, they will start to have all this. It actually helps in terms of sleep very well.
Do you see anyone's GFR go up?
Yes, also.
Okay, thank you. That's another topic.
Right, that one will need.
Wow. I can see actually where the dynamics is
right.
going.
If you can just get it right, like
it's
entirely correct. It's entirely blood flow. When you enhance your blood flow, a lot of miracles actually happens to your body.
And besides the therapy in your center side, what other things? Example, like do you all like focus on focusing add on looking into their diet, their lifestyle, fixing those kind of things, because sometimes people always feel that when we have a center like this, we just focus on just the machine. So are you all looking into like lifestyle? Are you all looking into like supplements? What you all would advise? Is there anything that whether it's like working on the bioflavonoids, working on your omega-3 is very, very important, working on the CoQ10,
right,
and dishing the statins.
Okay. Yeah, we have our own line of supplements now. CoQ10, magnesium, L-carnitine, D-ribose. Yeah, this
L-carnitine, D-ribose,
and D-ribose works perfectly well, especially with those with heart failure. Now, the other thing that I do is CCF.
Okay.
Okay, congestive heart failure actually can be reversed as well. Okay, but it takes a lot of monitoring. Now, heart failures and all, of course, we give them the supplements to take because that's what they actually need. Now, congestive heart failure needs more observation, but you just have to make sure that the patient is not fluid overloaded at the time that they are doing E-ECP.
Okay.
In that case, I can even give another example. I even had a patient who goes for hemodialysis. Right after his hemodialysis, he has to come for his E-ECP. The next day, no lah, he'll be, So it worked well, but you have to see what was your focus, what was your concern. He came to feel better, okay, more nitric oxide and, and he, if I'm not mistaken, he had a bit of a cardiac condition. His EF was a bit low lah. All right, his EF improved, not so much, but there was some improvement. He was very happy with it. You see, he didn't come to like revive his kidney, no.
Okay.
Because a lot of people do ask that.
That hope.
Yeah, that hope. He's a kidney patient. Can that? No. We are going to look at your heart, all right, and your overall well-being. Then we can do.
Nice. So where do you see yourself as a physician? I mean, I would say, you are much more senior in this segment of medicine in this E-ECP journey at the moment. Where do you see your journey going on? It's like, is it like you feel that there's going to be this need of like, look, we have this problem, we can see where the fear is, where the direction of disease is going. It is a pandemic.
Correct.
It's not if you are just thinking about non-communicable disease,
right,
this is a pandemic.
Right.
And what you think has to be done, and where are you all going?
Okay. A few things. Let me start with what I do. You see, when we first started, of course, we were advertising or even calling upon patients with angina, heart problems alone. But today we are not doing only that. If you're pre-diabetic, you're pre-hypertensive, try E-ECP. It reverses it. Because that's the same advice you will get from a GP. They say, you're pre-diabetic, go run, right? Come and do E-ECP, you can do the same thing if you don't have the time. All right, that is one.
If you have no 1 hour to run,
then you